Yesterday I presented the results of a clinical trial that was promoted by the GEL Tamo group and funded by the Takeda company. That was a trial with a new regimen for Hodgkin lymphoma patients in the refractory and relapsed setting as an induction induction of response prior to transplantation, to autologous stem cell transplantation. Most patients with Hodgkin lymphoma are cured with the first-line therapy, but there is still 20 to 30% of the patients that cannot be cured with the first attempt. For these patients, we need a different approach that includes at this moment reinduction therapy with polychemotherapy and autologous stem cell transplantation. And patients achieving complete response do very well. But most patients do not achieve complete response because the conventional regimens provide a median complete response rate about 30% as a mean. So with a new approach would be the use of new drugs in combination with the conventional chemotherapy, and this is the case. We have combined Brentuximab vedotin, which is the new drug, a new monoclonal antibody that has been used in Hodgkin lymphoma with good results in the past, but we want to use this new drug in earlier moments of the disease, such as second-line therapy before the transplantation. We combined Brentuximab vedotin with etoposide, solumedrine, high-dose RC, and cisplatin, which is a regimen very popular in Spain for these patients. With this regimen in the past, we usually obtained 50% of complete responses, but with the new regimen, we hope to increase the complete response rate. The regimen was given 3 cycles before the transplantation, and with this regimen, with a reasonable toxicity, not higher than the usual toxicity that we saw in the past with the conventional regimen, we increased the complete response rate from 50% to 71%. All patients that attempted collection of stem cells succeeded. In total, 64 patients collected sufficient number of peripheral stem cells for transplantation, and we finally could transplant 60 patients with a Bing regimen in the chemotherapy. The transplant succeeded in all patients. There were no engravement failures, with median recovery for neutrophil counts of 11 days and 12 days for platelets. And the final results were increased up to 83% complete responses after transplantation. Finally, the progression-free survival was high, 71%, with a time to tumor progression of 74% at 2.5 years, and an excellent overall survival of 91% of the patients alive after 2.5 years of evolution, with a median follow-up of 27 months. The results are good, are encouraging, and since it was a simple phase 1-2 trial, now we want to develop a phase 3 trial comparing in a randomized manner and prospective manner the old chemotherapy with this new combination.